would like to thank the organizing committee that allow me to share the experience about closing the ASD using Ceraflex. Thank you also for the support for the LifeTech company. So, transcatheter closure and the ASD closure become the treatment of choice. But however, the several cases such as a floppy limb, abnormal anatomy of the defect, such as malalignment of the septum, the closing of defect may be challenging. So, the Ceraflex is very new design that's more flexible and more soft, 600-degree rotation, accelerate endothelialization and decrease clot formation. So the technology is advanced. You can see here it can be
while depressing the orange safety button and upon pullback of the blue button, a pin connected to the nitinol wire loop retracts, which releases the occluder from the delivery device.
Okay, so you can see the film here. Yeah, so it's more easier to put the device across the septum. So what's different between the classical device and Ceraflex? So the advantage is similar, but it can be deployed without the tension. So it's much easier for the beginners. So. But it has a disadvantage, limited device size, relatively bigger delivery sheath, and the previous session said it might be difficult to retrieve with a standard setting, but it can be retrieved and also more expensive. Our experience in National Cardiac Center Harapan Kita, Indonesia. So this kind of the special cases. First, the ASD closure in small infants, less than 10 kgs. The ASD closure with the malalignment rain. ASD closure in large ASD in children, and also with a new technique with a zero fluoroscopy. So we have done 2 cases with the Ceraflex device in the infant less than 10 kgs. So this is the ASD. You can see the flow is very high. So now we can deploy. Look at it here. It's because of the left atrial volume is quite small. So it looks like a cobra shape, but don't worry. Just wait a couple of seconds, and then it will shape nicely. You can see here. Okay. And this is the follow-up. Yeah, the device looks like a bulge, but it's okay. The patient improving. Now patient's follow-ups also okay. This is the malalignment rim, the 8-year-old female with the secondary ASD. The T is you can see not at the same plane. The rims. So we put another multi-purpose catheter to help the landing zone, and then you can see here the device sit nicely with the left atrial approach. So another case, the 3-year-old girls with 10 kgs with the BSA 0.5, diameter ASD 18 millimeters. So we put the 24 Ceraflex here with the right upper pulmonary technique. You can see it again. Looks like not good, but you can see the device stored in place nicely. Okay, next. This is another technique that we use now for the last 8 months. We've tried to do the Transcatheter ASD Closure without a fluoroscopy. So among 37 patients until now, we do 2 patients with the Ceraflex device. So it's all the same, but this is the deployment of the device. The point is, it needs the shorter procedural time compared to the conventional device. So I think it's nice to use the Ceraflex. How is this embolized? Yeah, it's quite difficult. I read in the reference that's using the Malalignment forceps, but in my experience, it's very difficult. And I sent one patient with a embolized device with the Ceraflex go to the surgery. So the conclusion: the Ceraflex ASD Occluder is a novel device with some innovation, more flexible, that could be used as an alternative for some tough cases. But however, one of this limitation is difficulty retrieving in the embolized device. So the key point is the accurate position and accurate vehicle test. Thank you very much.
Any question? My comment is about the use of the Ceraflex. The most advantage of the Ceraflex to Cera is the use of this device in the small patient with significant septal malalignment and difficult alignment of the sheath and device with the septum while the procedure. You need to multiple technique, for example, right upper pulmonary vein technique, left upper, or technical support. My recommendation is to use of the big device in a small baby is better to avoid the use of the big device in a small baby, especially if you have a total length of the device to be higher than 40% of total length of the cardiac in these patients. It's better we remove this device, and it's better this patient go for surgery, because the device is very big for small patients, and erosion and so many difficult problems. For example, right upper pulmonary vein obstruction, SVC obstruction. Use of a big device in a small baby is very serious. But your final result by the echocardiography showed very good and excellent results. Thank you for your nice presentation.
Thank you, sir.
What do you mean by zero fluoroscopy?
So we use only from the T, not using fluoroscopy.
No, not
yeah.